Think about the last party you attended: a birthday party, a graduation party, a work party. Where did you fit in? Were you the center of attention? Were you an active participant? Or were you hiding in a corner hoping nobody would notice you? According to the Social Anxiety Institute, medical studies have reported that social anxiety is the third largest psychological disorder in the United States. I have struggled with social anxiety for most of my adult life, and unfortunately is something that I have inadvertently passed down to my own daughter. Ironically, though, despite my social anxiety hurdles, I am in school to become an elementary school teacher. The Anxiety and Depression Association of America has calculated approximately 15 million adults are affected by social anxiety in the U.S. today. 5% have been calculated as teens. Although social anxiety can occur in any gender, it is more prominent in females. I would now like to take some time to discuss the causes, symptoms, and treatments for social anxiety. First, I would like to bring awareness to the causes. One can be 2 to 6 times more likely to inherit the disorder if a parent or sibling also has it. However, while genetics plays a big part, one can also acquire the disorder simply by watching and empathizing with someone who is socially anxious, essentially learning the behavior. Other environmental instances, such as having had an unpleasant experience or being embarrassed in a social situation, also plays a factor. The final cause of social anxiety is the amygdala. This is the structure in the brain that controls one's fears. A heightened amygdala can be responsible for triggering and increasing the fear and anxiety levels. After discussing the causes of this severely uncomfortable disorder, I would now like to focus on the most common signs of the condition. The most common indicators of social anxiety usually begin to surface in the early teenage years, around age 13. Fear is the biggest symptom. Fear of being judged, fear of being embarrassed, fear of interacting with strangers, fear of how you think other people look at you. Worrying about looking like a fool in front of friends and strangers. Another common symptom of social anxiety is avoidance. Choosing to skip parties, performances, family gatherings, any place where you could be the center of attention, or where you may have to speak to someone. Among the emotional factors, the physical symptoms are not easily hidden. Increased heart rate, intense sweating, feeling nauseous, trembling of the hands, and muscle contractions are all signs of social anxiety, of having a social anxiety attack. Now I would like to take the time to share some ways in which to manage this disorder. Heading to the doctor to get a proper diagnosis is the first step in getting a treatment put into place. The effectiveness of each method can differ from person to person. Therapy is the most traditional route, especially when wanting to avoid being medicated. Psychotherapy or talk therapy is a common form of cognitive behavioral therapy, also known as CBT. CBT provides patients with techniques and practices in order to change their thought process when in social situations. Studies have shown that the average person with social anxiety will receive 12 to 16 weekly sessions lasting an hour to an hour and a half, with some beginning to see results just after the 6th week. Exposure therapy is a frequently used form of CBT. The therapist begins exposing the patient to situations that trigger the fears in an attempt to help them control their anxiety. If therapy doesn't work, the next step would be to try the medication avenue. SSRIs, or selective serotonin reuptake inhibitors, are typically the first choice when it comes to prescriptions. These pills work to slowly reabsorb the serotonin in the brain, regulating mood and anxiety. The 2 most widely known SSRIs are Zoloft and Prozac. Serotonin norepinephrine reuptake inhibitors, or SNRIs, are very similar to SSRIs. Cymbalta and Effexor XR are among the top SNRIs. Beta blockers, such as propranolol, may also be used to treat the physical symptoms of social anxiety. The final medication is one that is prescribed with extreme caution due to their addictive nature. Benzodiazepines, like Xanax. I have told you about the details surrounding social anxiety. First, the causes, then discussing the symptoms, and then the treatments. Now think back to my opening question. If you were the one hiding in the corner at the party, hoping no one would see you, then you and I might have something in common. Thank you.